Canada's chief public health officer says the country has reached two tragic milestones.
We have diagnosed over 200,000 cases of COVID-19 in Canada, and very sadly for all Canadians, we have lost more than 10,000 lives.
She says it's not getting better. Canada could have between 251 and 262,000 cases of COVID and another 400 deaths by November 8th. The problem is that every 100 people infected with COVID in turn infect more than 100 other people.
So when you're thinking of seeing people outside your household, ask yourself, is this absolutely necessary?
The health models show Canadians have to reduce contact with other people by 25% in order to send the virus curve downward, as shown by the blue line in this graph.
Not everybody can keep to exact numbers. It depends on your situation, but collectively, we need to reduce those contacts as much as possible.
When we did contact tracing, at the beginning, we'd be able to contact 10 people and trace them. Now, people are interacting with 50 to 100. And if you have 100 cases times 100, 10,000 contact tracing.
The province is looking at a targeted reopening of businesses in virus hotspots with extra measures to contain spread and defending the decision to close restaurants and gyms.
When you get an outbreak in a school or a long-term care facility, it didn't come from nowhere. It came from the community. And we know that the settings where people get it tend to be settings where people spend time together indoors for extended period of time.
The pandemic measures are temporary, the Prime Minister says, but in terms of months, not weeks. Lisa Hepfner, CHCH News.